All right, we are at the top of the hour, so we can go ahead and get started. Good afternoon, everyone, and thank you for coming to this Board of Animal Health Q4 webinar. Today, our speaker will be presenting on biosecurity and how to establish a good biosecurity plan for your farm. My name is Dr. Caitlin Macy, and I am the District 9 Field Veterinarian with the Board of Animal Health, and I will be the moderator for today's webinar. Today's speaker is Dr. Jennifer Strasser. Dr. Strasser earned her Bachelor of Science at the University of Notre Dame and then obtained her DVM at Oklahoma State University. After graduating, she worked primarily as a large animal veterinarian in a mixed animal practice in northern Indiana for 2 years before taking on 2 years of Johne's disease research in a mycobacteria lab. Dr. Strasser joined the Indiana State Board of Animal Health in 2003 as the Meat Source Safety Veterinarian. She became the District 1 Field Vet in 2005 up in the northwestern corner of Indiana and has been BOAH's aquaculture specialist since 2007. Just a couple of housekeeping items before we begin with Dr. Strasser's talk. We will have a Q&A session at the end of her talk. You are all muted. If you think of any questions during the presentation, please type them into the chat section and we will try to address as many as we can at the very end. Additionally, you are able to receive continuing education credit for this webinar. If you have signed in on Teams with your name, we will send your certificate to your email address that you signed in with. If you called in though, please email us to let us know that you have joined and we can send you your certificate if you would like one. So with that, please take it away, Dr. Strasser.
Thank you, Dr. Macy. Hi, everybody. Thank you for joining us today. I'm going to talk about sort of a timely subject right now, and that's biosecurity, kind of protecting your farm and your livestock. All right, and next slide, please. All right, so a little bit about the Board of Animal Health first. We are tasked with the prevention, detection, control, and eradication of infectious, contagious, and communicable diseases affecting the health of all animals. That includes the processing and distribution of products derived from the animals to control any health hazards that might threaten public health. So we cover it all if it has to do with animals and from a public health aspect. Next slide, please. All right, go ahead. We're going to talk about a couple of kind of hot topics that have received some press and a lot of attention recently that are tangentially related to biosecurity. So we thought we'd throw them in here. Next slide, please. So first of all, the first of these topics is the Asian longhorn tick. So it emerged as an invasive species in the United States back in 2017 when a lady out along the East Coast found one of these and later identified it. It was on her pet sheep. And since then, USDA and veterinarians across the country have been on high alert looking for more of these ticks. The first detection of an Asian longhorn tick in Indiana occurred a few years later and just a couple of years ago in April of 2023. So unfortunately, we were the 19th state to go ahead and receive this tick, which we really didn't want. And you can see on the slide which counties we have now found the Asian longhorn tick. So it's slowly spreading through our state. Next slide, please. All right. Oh, I didn't realize there wasn't. Okay, so we're going to talk a little bit more about the Asian longhorn tick. What's important to know about those is that the female does not need to be exposed to a male to lay eggs. So those tick populations can explode seemingly overnight. And the ticks are drawn to livestock, cattle in particular. And we know of a case that happened in Indiana where an adult cow was actually exsanguinated because of the number of ticks that were on board. So this is, it's not your typical tick. They can carry some diseases, but exsanguination is a real threat with these because their population can explode so quickly. And just overwhelm a host. Okay, now we'll move on to New World Screwworm. That's another hot topic that's going on. You may have seen things in the news. The government has been spending some money trying to control New World Screwworm and prevent it from entering the US. So there was a recent detection in Mexico, which is concerning because we were previously able to hold this tick down to South America and Southern Central America at the Isthmus of Panama, at the Panama Canal. And that was really the bottleneck where we were trying to keep this tick south of that point so that it wouldn't have the opportunity to enter the United States on land or on animals moving across the land. So in 2023, New World Screwworm detections in Panama unfortunately exploded from an average of 25 cases per year to more than 6,500 cases. And that was where it sort of breached those defenses there at the Panama Canal. Okay, next slide. So the New World Screwworm name refers to the maggot's feeding behavior as they burrow or screw into the wound, causing extensive damage by destroying the host tissue with sharp mouth hooks. And that is not just dead tissue. They actually burrow into living tissue. So that's what makes these maggots a lot different than the normal maggots that we might see in practice on livestock or, cats with wounds that have been open to the environment. We've all kind of seen maggots in those sort of wounds. But this is different because these actually cause further damage and burrow into living tissue. So these flies are attracted to any bodily openings, wounds, mucous membranes, and they lay a lot of eggs, up to 400 eggs at a time. And one female can produce about 3,000 eggs in its lifetime. Next slide, please. All right, disease transmission. So we're going to talk a little bit about highly pathogenic avian influenza as a model of how diseases are transmitted. Next slide, please. All right, so the past few years, we've been dealing with this disease on sort of a cyclical basis. And you can see in these photographs here, this was a turkey barn where this can really devastate a flock in a day, really just a few hours, and can take birds from their normal happy selves, kind of visiting with their friends, making lots of noise. You can't hear yourself think inside that barn full of poultry. And then a couple hours later, they go from normal to just kind of hunkered down, kind of looking like sick birds, pretty lethargic. Nobody's talking. They're just kind of hunched down and in one spot. And then just shortly after that, just a few hours later, the majority of those birds are actually dead. This is particularly true in turkeys, and we can see it in chickens as well, where the birds actually die very quickly from the disease. So we've lost a lot of poultry in Indiana over the years. And I think that the number that's on this slide is not correct anymore because we're in the middle of one of these outbreaks and are losing more birds daily. Let's go to the next slide. Okay, and this map is just a picture of how you see Indiana is right under the fly zone where a lot of these birds migrate. The wild bird or the wild geese and the wild ducks flying directly over Indiana and depositing infected droppings or stopping on our ponds and little waterways during their journey, and then commingling with our native ducks and geese, the ones that just sort of stay here. So it's not a good situation. Those migrating birds can bring disease to Indiana every year as they pass over, and they've been doing that recently. All right, let's go to the next slide. Okay, so we talked about that, but now we're going to jump to this disease of unknown origin that started popping up in 2023 down in the Texas Panhandle in our dairy farms. All right, so the clinical signs that the farmers and veterinarians were seeing were kind of non-specific, just sort of a decrease in food consumption, rumination, rumen motility were decreased. So something was going on. These are, sick dairy cattle. Things aren't quite right. A little bit of nasal discharge, nothing too alarming there. But they were seeing a drop in milk production. So that was probably the big clinical sign and very worrisome to the dairy farmers, along with some abnormal manure. And then the cows looked a little lethargic, maybe seemed dehydrated, and some of them were running fevers. So the cattle that were most affected either produced no milk at all, or their milk was a very strange consistency where it was thick and kind of colostrum-like, which was, not when they were producing colostrum. And so that was very strange. And a lot of people were looking at all these clinical signs, trying to figure out what was going on with these cows. Next slide, please. All right, so we sort of gave it away with the title of this section, but eventually, after extensively testing for a lot of different diseases, highly pathogenic avian influenza strain H5N1 was actually isolated from these cattle. And that was determined to be the cause of this illness. The virus in cattle is actually predominantly found in the mammary tissue and then in the milk, regardless of any of the symptoms that the cow shows. And infected cattle can be either asymptomatic, which those are the subclinical animals, or the symptomatic cattle with the decrease in milk production and some of those other symptoms. All right, next slide. Great. So currently, the epidemiologic investigation on the dairy farm highly pathogenic avian influenza, it's determined that occurred as a spillover event from wild birds. And there are typically 12 to 25 days between the introduction of the virus and clinical signs showing up in the cattle. So there may be other species involved potentially, such as cats. And we know that cats are very susceptible to highly pathogenic avian influenza and tend to die from it. So they could be transmitting the virus through the dairies. A lot of dairies have cats around. So that's a possibility. And the studies kind of point to poor biosecurity as a major source of the spread, or a cause that contributed to the spread of HPAI between dairies. So the genetic testing that was done on the virus showed that it spread also from cattle premises to poultry premises. So poor biosecurity can affect other farms and even other species. So the cattle moving from one farm to another could transmit it to other farms, or even people going back and forth. Just poor biosecurity in general could lead to further infection at additional farms of the same type, aka other dairy farms, or also on poultry premises. So that's very concerning that we can get multiple livestock species involved in this one sort of outbreak. All right, next slide, please. Okay, so sometimes when we see highly pathogenic avian influenza on a farm, it's a point source introduction. So here in this picture, we can see the wild birds flying over and dropping virus on individual farms. So in the first three to the left, those turkey barns each experience a point source introduction from the wild. And then in that third farm, it actually leads to lateral transmission to another farm by poor biosecurity practices, infecting a fourth farm after that third one was infected. So that could be fomites, vehicles, dogs and cats, just farm animals running back and forth, depending on whether those barns are on the same property or if it's, a different premises altogether. But both scenarios happen, and people can also transmit the virus if they work in the different barns on the farm, et cetera. All right, next slide, please. And this is just another diagram of the lateral spread. In cattle, it seems like it has been much more likely that lateral spread has been occurring through poor biosecurity, where you have the one-point source introduction of that original initial herd, and then via cattle movement and just fomites and poor biosecurity in general, that first infected herd then contributed to infecting herds on other farms, other premises in Texas and other states. And so it's been found in many other states across the US now in these dairy cattle herds. And then, like I said, there was the testing that signified that the virus could also move from the dairy farm onto the poultry premises. And that's if you follow the arrows around that last arrow going from the cow to the turkey. Okay, next slide, please. All right, so this is a good example of why there needs to be a biosecurity plan on these farms. Let's go to the next slide. All right, so what is a good biosecurity plan? What does it have as the base components? So what do we need? A good biosecurity plan needs to be specialized for each facility. These don't work as a one size fits all. They definitely need to be tailored to that facility. They need to be simple and easily implemented. So extensive plans are quite an investment, and the farmer may be reluctant to make that investment to start with, or if the investment is too much, then it's detrimental to the farm because it uses too many of the resources just trying to watch out for biosecurity. And so we need to keep an eye on that cost benefit equation and make sure that the cost of the biosecurity isn't outweighing the benefit. So it needs to be practical. Hazards that are specific to that farm need to be identified, as well as the risks that those hazards pose. And then the interventions that are part of the plan need to be prioritized. Next slide. Okay, so one important thing is working with a veterinarian, establishing a veterinary client-patient relationship. So just an aside, do you guys all recognize the veterinarian in this photograph? The bottom of the slide sort of gives it away, but that's actually a photo of the real James Herriot back when he was still practicing. So a VCPR is really important for these farms to just establish that and have a veterinarian kind of on call in case they experience emergencies or urgent cases that need veterinary attention. So that annual visit, establishing that relationship is going to allow that access. And then, of course, prescriptions, veterinary feed directive, drugs, feedstuffs, all those come under that having to have a VCPR established. All right, next slide. Okay, and making sure to talk with your veterinarian while they're there. This is a little more current picture of what our veterinarians typically look like out on the farms. So producers want to tap into the veterinarian's knowledge. And it's important for the veterinarians and producers to work together to figure out what the producer can do for themselves versus when to call. So veterinarians these days are all very busy. Large animal veterinarians cover large territories, and oftentimes it's helpful if the producer has a little bit of training, if the veterinarian is able to invest a little bit of time on that producer so that they know, hey, if this pops up, I really need to call my vet, whereas, oh, this is something minor, and yeah, my veterinarian gave me a protocol for dealing with this and I can just deal with it on the farm here. So that's kind of a nice feature when you have a good relationship with your veterinarian that helps the veterinarians manage their clients and helps the client have pretty good service and better disease control, things like that. Veterinarians are also knowledgeable in herd management practices, and so that's something good to discuss between clients and veterinarians as well. And then kind of just rolling into that herd management practices, biosecurity protocols should fit right in there. So discussing practical biosecurity methods is a really important part of conversations between veterinarians and clients. All right, next slide, please. Okay, so this is just this is almost a commercial for our veterinary practice finder. If any of you want to check out the QR code, it will link you to our page where the veterinary practice finder will soon be live, and it's a way for producers, animal owners to find veterinarians in their areas, because we know that there are areas of the state where it's difficult for people to find a veterinarian who is able to come to their house or farm. So this is just something to keep in mind, that it's out there on our website, and it'll be live soon in January. So, all right, next slide, please. Okay, so the second thing to keep in mind would be the preventative care and husbandry. Vaccinations, reducing disease exposure, good nutrition, and knowing your herd or flock. These are all important things for the producer to be aware of, and maybe things to talk about with their veterinarian. Making sure to monitor their animals, typically on a daily basis, although some livestock are, not up close to the house, and so it might not be quite a daily basis, but making sure to monitor your animals and report unusual findings or clinical signs, including any unexplained deaths or illnesses. So the typical animal owner would first probably report those findings to their private veterinarian. And then if the veterinarian sees that it's something unusual outside the scope of normal practice, that would be something for the veterinarian to then report to their field veterinarian at the Board of Animal Health. All right, next slide. Okay, a third point is pest and vector control, also very important. I guess suppose at certain times of year, it's more important than others, but pests and vectors are a way that diseases are moved very frequently. So flies, ticks, mosquitoes, rodents, wild birds. So the animal owner, it's important for them to remove any reservoirs such as weeds, standing water, waste products, and just farm trash. Old, implements, feed sacks, anything like that. A lot of pests really like that sort of environment. So keeping the farm nice and clean really helps to manage pests and vectors. Using appropriate preventative or control products is also important, and then vaccinating for the diseases that can be vaccinated for that are carried by the pests and vectors. And just minimizing the environmental exposure, that kind of goes along with things like if the livestock that you have are horses, maybe you want to keep them in the barn at dawn and dusk when the mosquitoes are most active. That sort of thing is minimizing the environmental exposure. Maybe if you have a large pasture that's bordered by woods, mowing a 30-foot strip of the grass that's adjacent to the woods to maybe stop the incursion of ticks into that pasture. Those sort of things help to minimize that environmental exposure of the animals. Next slide. Sanitation is very important. We talked about that slightly on the previous slide, but controlling vectors starts with good sanitation. So dead animal disposal. Unfortunately, in this picture here is a dead kitty. That was actually taken on a dairy farm, and the veterinarian had contacted me concerned that maybe they had avian influenza in the area on their dairy farm because he had spied a dead kitty cat and was concerned about maybe testing the cattle to see what was happening there. Fortunately, they were negative, so I think it was some other unfortunate event happened with this cat. So, but dead animals disposal is very important. Otherwise, they draw those pests that we don't want, as well as manure and waste handling. If manure is composted or kept in a pile, that needs to be away from the barns, away from the animals, and preferably covered so that pests can't get to it and then track back to the barn anything that's out in that manure pile. Eliminating trash around the barns, old equipment, things like that would draw the pests is also important, as we discussed previously. Okay, next slide. Okay, so here's a big one. So this is probably the biggest way to bring disease to a farm, by buying it. So a lot of people get excited and want to buy new additions to their herd or flock, and maybe don't do their homework on checking on the health background of those animals that they're bringing in, or quarantine periods, isolation stalls, lots, things like that are sometimes hard to manage, and they're just time consuming, and it's just onerous to work with those things. And and keep those animals isolated for, 4 weeks or so before they get introduced to the rest of the herd. And so that poor biosecurity opens up the established herd to the introduction of disease through the new animals or animals returning from other places. Even if it was an animal that was on that site originally, if it left and went to an exhibition or was off-site for breeding or training or something like that, and then comes back home, those animals always need to be quarantined or isolated from the rest of the animals on the farm. So this is something that veterinarians and clients can really discuss, and the veterinarian should encourage the client to go ahead and follow those quarantine procedures, and even things that veterinarians are familiar with, working with the established animals first, and then the new animal that could potentially have diseases, do chores on that animal last, things like that. So discussing that with clients is very important. And, so control measures that come into play with this sort of thing is isolating and observing the incoming animals before allowing them back into the herd. Most diseases, we say 4 weeks, 30 days, somewhere in that ballpark, to be safe. Veterinary inspections with negative laboratory test results on any worrisome diseases that might be able to be tested for. So that would be something like a Coggins test on a horse that's coming in. And vaccinating or retesting when appropriate. So if you're concerned that some animals are coming in and they're not currently vaccinated, maybe it's time to update their vaccinations while they're in that quarantine period before they get introduced into the rest of the herd. So those are all strategies to talk through with clients so that they see the importance of these strategies and the importance of biosecurity and protecting their farm. Next slide, please. Okay, visitors. So visitors are fun, but in recent years, we've come to realize that they are a threat to the health of our livestock. And this includes people that are just wanting to come by and see the fun animals, sometimes even family, if they're not the typical workers in the barn, or if they have contact with outside farms and barns and animals, delivery and maintenance personnel, feed trucks, just an assortment of people that are on the farm for necessary reasons. But there are control measures that can be put into place. And so those include avoiding foot traffic in and around the barns, feedlots, and pastures. So the folks that come in that are necessary services, trash removal, feed trucks, manure removal, things like that, if they don't have to go into the animal areas, clients should be cautioned that if they can have dedicated driveways or dedicated areas where those trucks can come and go and not necessarily cross the paths where the livestock are contained, that is definitely preferable and increases the biosecurity of that farm. Limiting visitor vehicles to those designated areas as well, parking away from the animals, and limiting the contact of people that are actually even entering the barn, having contact with the animals. And if they do need to have contact with those animals, or just, if it's a barn where you're trying to encourage the public to come in and become familiar with farm animals, that clean clothing or PPE and at least shoe covers should be provided for the public coming through there, so that there is less chance of contamination of those animals with some sort of pathogen from an outside farm. Signage is good, disinfection steps. So some of these are something that you might not find in an everyday situation, but I'll tell you the Tyvek and boots and spraying down tires is something that we're living every day, multiple times a day right now with this highly pathogenic avian influenza outbreak. So this looks very familiar. All right, next slide, please. All right, clean hands and feet. So that's, the basics of biosecurity, right? And I think all of our veterinary personnel are pretty familiar with, we need to have, washed and sanitized hands and feet if you've been anywhere where there are livestock. So that's really important. So here in the center, we have a picture of some of the booties, the disposable footwear that can be provided to visitors at barns. Unfortunately, the picture at the bottom right with the doormat there was taken at a livestock producer meeting where a lot of people had come to this meeting and, you know, perhaps were still wearing their barn boots to the meeting where they're mingling with other producers with like animals at home and just walking across that carpet, then people could potentially track back to their farm diseases from a different farm. So that's something that we do not like to see. And of course, somebody washing their hands. But it's important to wash hands, wear clean footwear around the animals. Dedicated shoes are super important. So that mat highlights the importance of that. And even, you know, in your home, having different shoes and then having dedicated boots that go out to the barn, and that's the only place that they're worn. So we just don't want to be tracking diseases between different barns, or if there are visitors to the house that have been at other farms, then maybe they're tracking something to your house and you are able to put on your barn only boots to go out to the barn. So whatever they've tracked to your house stays in the house and doesn't get tracked back to the animals. So that's something to consider discussing with clients and just making them more aware of biosecurity, especially when we're in the midst of an outbreak. Right now in Indiana, we're dealing with the highly pathogenic avian influenza, but other parts of the country are dealing with equine herpes virus also. And, you know, we had horses that have been exposed as well. So biosecurity is a very timely topic, and not just for one species of animals, because we end up with diseases kind of making their way through different livestock populations over the course of a year, every year. All right, next slide, please. So those big things matter, and it's important to implement all the big things, quarantining the animals coming in, and, you know, all the vaccination protocols, everything like that. But you don't want your clients to overlook the small stuff, things that they should be doing every day. Just simple things like washing hands and dedicating boots. Next slide, please. All right, so common diseases can have a big impact. And so those are things that you might deal with on an annual basis, or, you know, just something that you always think, oh, well, this is going to impact this herd again because they see it every year this time of year. So your normal herd and flock health routines, vaccinations, nutrition. So that's a big one. Unfortunately, the veterinarians at the Board of Animal Health see a lot of nutrition issues when we get called in to investigate welfare cases. And some of those animals, you know, their immune systems are so depressed because they're just receiving inadequate feed. So the normal management things that we think of are important to discuss with clients to make sure they're keeping their animals on a good plane of nutrition and just their the veterinary background, so that they're up to date on their vaccines and as resistant to diseases as we can get those animals. You know, those preventable common diseases, it's good to prevent them rather than having to treat them. So encouraging the clients to be proactive, reducing risk, and again, being observant of their animals. They know how their animals normally act, and encouraging them to call sooner rather than later when they start to see signs that something is amiss. Next slide, please. All right, so some of the common threats, just to mention a few, would be shipping fever, pneumonia, sore mouth in sheep and goats. So something that's, you know, these are all very easily transmissible diseases and problems that can be really curtailed by some biosecurity. Maybe they infect a group of animals, but you can prevent them from infecting further animals on that farm by practicing biosecurity. Strangles in horses, influenza in horses and other animals. And then, you know, other things like GI parasites, lice, ringworm, issues like that. So all very common threats and kind of small and minor because a lot of people deal with them on a pretty routine basis, but good biosecurity can go a long way in preventing a lot of these issues. All right, next slide. Okay, so good biosecurity plans, just a quick review, need to be specialized for each facility. So it's important to take the time to walk through that facility, talk with the producer, and determine what the hazards are on that particular farm. What do, you know, the activities that they're involved in, what risks do those lead to, and how can we intervene and minimize the risk that they're exposing their animals to diseases? And at the same time, keeping in mind that we want a biosecurity plan to be fairly simple and easily implemented every single day, right? So if they think, oh, well, we're going to write up this great biosecurity plan, but it's so complicated that nobody can follow it on a routine basis, it really does no good. So trying to keep it simple, relatively inexpensive, makes these plans much more easily implemented and much more likely to be followed. And another thing I want to mention too is a biosecurity plan isn't just a static thing that you write it down and keep it in a binder on a shelf somewhere. It's something that needs to be revisited periodically as items or management practices at a facility change over time, or even if they add a new species or a different class of livestock. So it can all affect how the biosecurity plan is implemented and what's important to pay attention to. All right, next slide, please. Okay, so just real quick here in Indiana, you can see that we're pretty high up in our national production rankings in a lot of the poultry products. Ducks and veal were #1, eggs were #3 in pounds of turkey produced, 5 in swine produced, and #15 in milk produced. So Indiana has a lot of animal agriculture, and we're working hard to try to protect that from the incursion of infectious diseases. So we're #2 in the nation in livestock growth from the 10 years from 2005 to 2015. So we were seeing a lot of increase in the number of livestock in our state during that time. And our national ranking in egg exports is $18.3 billion. And so we're behind some of the really big states, California, Texas. Some of those states are in front of us, Nebraska, Iowa. But we're right up there, little Indiana, with a lot of ag exports here with #8. Okay, next slide, please. All right, so it's important to remind your clients to register their premises with the Board of Animal Health. This really helps us whenever we are experiencing an outbreak or we're concerned about a disease that may be hitting Indiana as we look at the national picture. So in these maps, you can see just the cattle, swine, and poultry premises that we have registered, and the most densely populated areas for each of those species is highlighted in yellow, and then red, and then a little more sparse in the blue and white areas. But you can see that we have, animals scattered across the state and sort of where the concentrations are. So unfortunately, if you look at the poultry map, the little yellow egg-shaped section there in LaGrange and Elkhart counties is right where we're experiencing our highly pathogenic avian influenza outbreak. And so we're getting a lot of farms infected because of the density of farms there. But the same thing could happen if we had outbreaks of other diseases in one of our other livestock commodities, and it ends up being in one of these highly or densely populated areas. And disease just travels very easily from farm to farm when you have a population that dense. Right, next slide, please. Okay, so that's all we have, but we want to remind you all to reach out to BOAH if you see anything unusual in the way of animal diseases. If you have questions on anything or need assistance, contact your field veterinarian also. And that's something, if you don't know who your field veterinarian is from BOAH, you can always call the main office and they can let you know which of us covers your county. And then we're a resource also. The private veterinarians in my district, I think, call me fairly often, and I'm typically glad when they do, both on animal disease issues and animal welfare issues. And we have some good discussions on the phone. So that's important to have that information.
All right. Thank you so much for this fantastic presentation, Dr. Strasser. Just wanted to let everybody know this is the ideal time to submit any comments or questions you have in the chat section, and we will do our best to answer them. And we just wanted to, while we're waiting for that, we wanted to let you know that you will be receiving continuing education credit for this webinar via email in the coming weeks. And with that continuing education credit will be a recording as well of this presentation. The recording will be on BOAH's YouTube site. If you called in, or if there are numerous individuals together in a group, please email us to let us know that you joined, and we can send each of you a certificate. And noticing that there are no comments or questions at this time, with that, we thank you very much, Dr. Strasser, and hope that everyone has a wonderful afternoon.
All right. Thank you,
Thank
Dr.
you.
Macy, and thank you, everybody.